Hi, everyone. My name is Carter Peterson. I'm one of the medical case managers that work at JustUs Health. Been here for about 4 years. Started off as an intern and worked my way up through risk reduction with testing and outreach, and then eventually joined the case management team, and have been doing that for the past 3 years. One of the things that I come into contact a lot with is people that don't necessarily know what case management is. And this can be anyone from a client that is contemplating it, or just my people that I know in my personal life. I tell people that I'm a medical case manager, and a lot of times I get a lot of confusion from that. And I'm just here to briefly talk about what our program is and what it can do for you. And if you're interested in it, how you can get connected. So a quick brief overview of our program. Our team consists of 9 case managers, a program assistant, and a supervisor, so about 11 of us total. Of the 11 of us, 7 case managers work in the metro area. So to kind of give that context, we serve Hennepin County, Ramsey County, and any county that surrounds the 7-county metro area. So that would be Dakota County, Anoka County, Carver County, and a few other counties that I cannot remember the name of. But of those 7, that's where we primarily serve. We work out of the agency in St. Paul. In addition to that, one community case manager is based out of North Memorial Health Clinic in Robbinsdale. They do a little bit of a hybrid of where they're in our office, and then they will have a station at North Memorial. And in addition, they also visit Clare Terrace in Robbinsdale because it's very close by. And then finally, we do have one case manager based out of Essentia Health in Duluth, Minnesota. Each case manager works with approximately 40 to 50 clients. And, the main goal of our work is it's designed for you. We are here to be your advocate. We're not here to tell you what we think you should do or what we see that is a barrier. We address everything on a case-by-case basis. So the big question is what can case management do for you? Or, what's the point of our job? So a medical case manager, they want to make sure that you're connected to a provider. Sometimes we get referrals for case management that are from people that are out of state, that are looking to get set up for the first time. They don't really know our healthcare systems in Minnesota. They don't know who has an infectious disease clinic. They may not necessarily trust the providers that they're seeing, or maybe they have some issues from their previous provider. We want to make sure that you are comfortable with the provider that you're seeing, because that's how we believe that that's how you're going to have the best health outcomes for you. In addition to that, we help you keep your insurance enrolled. That would be anything from Medicare, Medicaid, Program HH, which is a payer last resort program that we can talk about a little bit later, and any other private healthcare plan that you might be on, if it's through an employer or through the open market on MNsure. Insurance is a big barrier as to why people don't see a provider, and we want to make sure that, if you're living with HIV, the fact of the matter is that being engaged in your healthcare is kind of the best thing for anyone to make sure that you are achieving the health outcomes that you're looking for. In addition to that, we also make sure that you have access to getting to and from medical appointments. This means that if transportation is a barrier, we do have a transportation program or work with other programs in the area to make sure that you can get from point A to point B without any complication or anxiety. Because a big barrier for why people don't go to get their labs done or to check in with their providers because they have no way there. We're here to help with that. And in addition, if there's any barriers that may be in the way of accessing your medications, whether it's transportation or insurance, we want to make sure that you're taking your meds, because if you're not taking your meds and you're not taking care of yourself, and that's a concern for us, and we want to make sure that that is being addressed in a way that is looking out for your best interest, not what we think is best for you. A couple of things that are out of our scope is just, housing is a big one. I know I'm going out of order here, but we get this a lot. It's not that we can't help with housing. It doesn't mean that we will never help with referrals or pointing people in the right direction. But my job and the job of my team is to really address any medical barriers first and foremost. That is what our job is designed to do. Now, you know, the phrase housing is healthcare, absolutely, we agree with that 100%. But at the same time, like, I'm not an expert in housing. I don't necessarily know how all those programs work. So I don't want to give anybody false hope stating that that is something that I will be an expert on. At our agency, you know, we have our THP program, and we also have housing advocate services that can really work with you if you qualify for the program. And that would be something that we would discuss later on once you started the case management program. And then everything else is kind of on a case by case basis. You know, in the time that I've worked at JustUs Health, I've helped clients with housing, in addition, finding employment resources, food resources, energy assistance programs, just to name a few. And it's really been helpful because, you know, I get to learn how these systems work, and how also to how the community can better serve you as an individual. So the big question you may be asking, if I've already sold case management to you, is how do you get into case management? Well, the first step is you need to contact our Minnesota AIDS line. They are our one-stop shop as far as really making sure that case management might be the right fit for you. Now, the nice thing about AIDS line is that you can call from anywhere. We get calls from all over the state, and sometimes even all over the country, depending on how people find us. But it's a great source. Like, you see a 612 number for local callers, an 800 number for people that are outside of that area. You can also text or chat online at our website. But when you talk with them, you can tell them what you're looking for. If you're looking for case management, and if you want to work with JustUs Health, you know, speak up and advocate for yourself. We'll be more than happy to work with you. Sometimes, though, you might find that our case management program isn't right for you. Either it's too far away, or it's we don't serve your area. That's a big one why we wouldn't be able to help you, is if you're out of our area. We know other places that can help. To name a few, Youth and AIDS Project, if you're between a certain age demographic. If you live in greater Minnesota, there's RAN, the Rural AIDS Action Network. They're all there to support you, and we're all in this together. So even though you may not work with JustUs Health, just know that your case management should be consistent no matter where you get it from. Another big thing about our case management program, in order to be eligible for it, you do need to be living with HIV. The reason being is that my job and the jobs of my colleagues are funded by Ryan White federal funding that gets trickled down to the state level and then dispersed across the state depending on what agency has access to that funding. So we do need to medically verify that you are living with HIV, that it gets stored in we get stored in a chart that we would have to verify that you are indeed eligible for the program based off a qualifying medical condition. And on top of that, the other big one is you need to reside in the state of Minnesota. You know, people move and stuff like that, and that's fine. But, you know, unfortunately, because our funding is tied to the state, we do need you to live in Minnesota for at least the majority of your year. And then on top of that, you need to be enrolled in Program HH upon referral. This is something that AIDS Line can help with. And also too, if it's not done by the time that you get to us, that's fine. We can certainly help you with it too. But in order for us to serve you, Program HH is the thing that holds it all together. So we just ask that you can be enrolled, and then anytime you need any help with eligibility to maintain Program HH benefits, we can certainly help with that as we go along. Now, you know, the one big thing about that is, you know, there might be someone out here watching this. It's like, I don't have HIV. Do I need to go get HIV to get case management? And I would never recommend that to anyone. But if you are looking for case management and you don't have HIV, there are other options for you. Mental health case management is a great option. I hate to say I don't know what the qualifications are for mental health case management, because I think that's a little bit more open and a little bit more broader of a range of what is allowed. But that is something that I would definitely look into if that's something that you think that you might want or need. And in addition to that, non-medical case management is out there, but I will be honest, it is very limited. Mostly due to the fact that medical case management has kind of been the first and foremost thing that a lot of people associate when people want case management and just being frank. A lot of times people will say that, you know, if you have a medical issue like HIV, there might be a little other things going on in your life that we want to make sure that we can help navigate through. But some people just need assistance or advocacy and they don't have HIV and they don't have mental health conditions. They just really need to make sure that they have someone on their side and in their corner to help them. And, you know, I wish you all the best of luck if that is your situation. Again, like, you know, it's few and far between. And I hope that in time we will see more non-medical case management opportunities open up in the future. You know, and as a reminder, we're here to help. You know, I don't want to sound like doom and gloom about the fact that maybe you don't qualify, but, you know, AIDS Line, our benefits team, if you ever need something that's just quick and easy and just a resource, you know, we are more than happy to help on that level. Case management is kind of a commitment. It's not something that I think people should take lightheartedly, but also at the same time to, you know, it's not for everybody. Some people don't really need a constant check-in. Some people just need that quick little, like, can you help me answer this brief question, or can you help me apply for insurance? And we can do that. And, you know, calling our AIDS line and just having an honest conversation is the best thing that you can do. So with that, I just want to say thank you for watching this presentation. I hope that this has been informative. And if you have any questions, again, please contact our AIDS line and we will get in touch soon. Thank you. Bye-bye.